Good afternoon. I'm standing between you and your going home time, but thank you, IOSH, Kelly, and Dimple for providing this space for me to share on a very close to heart topic, mental health. It's quite interesting. Mental health integration to safety. But I thought it should be part of safety. Yeah, but then it also speaks about something, right? It has not been integrated well enough or intentional enough. So we need to talk about it. And I think in the last decades, we feel very safe walking into our workplace, offices, as well as factory floor in terms of physical safety. And that is because there are H&S strategy, policies, and regulations. And it takes many years to reach there. So we can check in knowing that physically we can be taken care of in terms of safety. But I hope my children and grandchildren will be in a space whereby they walk into offices, factories, knowing that their mental and psychological safety is well taken care of. And that's what we do. At My Forward Alliance, we help companies to create mentally healthy workplaces. And today I'm going to share a bit more on the things that we do. And I know the H&S group of people are very much into measurability, sustainability. I've sat through yesterday, I've sat through today, it resonates and it is in my face. But I'm very glad that today in the second half of the session, we talk a bit more on mental health, which is something that I'm going to talk a bit more on as well. So why are we creating mentally healthy workplaces? Because the workplace is about people, right? And when people thrive, the business will flourish. But unfortunately, many times, businesses and leaders in business treat people just like machine. When they are down, they just ship it out and bring on a new one. And it's unfortunate. And hopefully, we are here to change that. So I'm going to share with you, and I hope that it will be interactive, right? So how many of you say that this is a safe environment to work in? Yes? Yeah, right? All the checks are there. Okay? How many of you say that it is not a safe environment to work in? Nobody. Okay. And I see not everyone raise their hand. How many of you say that you don't know? Okay. So there are some second thoughts. So it's the greatest safety hazard in the picture that you cannot see. The person. What about the person? If I tell you he's physically fit, sorry? Complacent. Okay. What else? What if I tell you that he has not been sleeping well the last 3 nights because of acute stress? Or what if I tell you that he's working in an environment that there is bullying? What is the risk factor right now? He's operating a machine, right? Although it is certified safe, the machine, but the operator may not be 100% safe. And that itself is a risk multiplier. And it's important for us because many times we talk about psychological safety and all these things. And in H&S area, what we see, we say, and we try to change it. But sometimes some things are unseen, right? And the problem we face in Singapore is a $16 billion problem. It's $16 billion that affects all businesses. No one is spared. It doesn't come from me. If you Google that 16 billion problem is on lost productivity arising from depression and anxiety. And that was published in 2023 in a paper by NUS and IMH. And if you look at globally, right, it is a US $1 trillion problem annually. And it sounds familiar. It sounds like someone's pay package, right? But that is the problem we face on mental ill health. How are you tackling it? So we talk about mental health as a safety risk multiplier, and a stress manager misses red flags. Hopefully, he himself, and it is fundamental component to overall safety. It affects the action. And let's do another survey. Let's think about your workplace. How many of you have a health and safety strategy and policy? Not all. We've overread. Okay, but it's okay. Keep your hands up. And of those hands are raised, how many of you have a mental health strategy? Okay. Some hands are down, more hands are, their hands still up. And how many of you feel that your mental health strategy sticks, is operationalized, and you see it in your day-to-day? Okay, lesser hands. But there are still hands raised. So you see that it's not about just having a paper strategy. It's good on paper. It's good for C-suite to talk about it. But it doesn't make a difference if it is not hitting the ground. Because your strategy needs to stick, and it has to be part of your day-to-day operation. And I hope that in the next couple of minutes, I will share something that is practical, not theory. Okay, I'm a practitioner. I came from finance. If you go on LinkedIn, I've been a finance person for the last 27 years, pivoted into this space, and I'm very passionate about it. Okay, and it is something that is measurable. And it's very important because what you can measure, you can manage. And we all know that. So unmanaged psychological risk is not a separate wellness issue at all. It is a safety risk multiplier. Are you familiar with all this? Many organizations would have some of these things, if not all, if not many more, right? Itself is important for various individuals, but by itself, it is not complete. Why do I say that? It seems like it's going to be an ad hoc kind of approach, a lunchtime talk, a mental health day, week, or month kind of activity. But we all know, right? Mental health is 24/7, 365. Okay? And if you are the leadership telling people about mental health, doing ad hoc projects, and you as an employee, do you feel safe enough to really own up and say, hey, I'm not doing really well? And that's where I feel that there is a disconnect. While all these things are good for individuals, you can't measure it. What's the effectiveness? How sustainable is that? Or are you, from a HR perspective, from a management perspective, telling yourself and kidding yourself that, hey, I've done some things for my people. It's up to them. I've helped them to be resilient. I've helped them to be mindful in what they are doing. And therefore, it's up to them to really internalize and live it out. And then the whole culture in the workplace might be toxic. And it's crazy to think that you can work in a toxic environment when you are just equipped with all these fragmented handles, right? So it doesn't work that way. It has to be a holistic system, just like what you are doing in the physical safety environment. The machines, the people, there are demarcated area, there are also trainings involved to better equip the people. Same thing as mental health. And in fact, WHO define health as what? PMS, physical, mental, and social. Okay? And that is part of health. And for the many years, we are only focusing on the physical, which is unfortunate. And I am glad that COVID has brought a greater awareness of the importance of the mental health. So high job demands, poor managerial support, lack of control is as capable of causing harm as a faulty machine or a slippery floor. Without a framework, these risks remain unassessed, unmitigated, and unmeasured. So earlier on, I talked about you can't measure you can't manage what you can't measure. And that's where I would like to introduce the Thriving at Work framework. It has 3 pillars, 10 standards across the 3 pillars. It provides a systematic, sustainable, and measurable way to manage and operationalize a mental health strategy. The Mindful Thriving at Work framework is evidence-based blueprint that removes guesswork from your strategy. And this is developed together with Wellbeing Research Center at Oxford University. This is a management system to operationalize your strategy. It is comprehensive. The 3-pillar structure is designed in such a way that we can actually systematically implement the strategy. So this page, you'll see that under the 3 pillars, the first pillar being culture, second pillar being environment, and the third pillar being support. And across the 3 pillars are 10 different standards that runs from communication, senior leadership, looking at people management, the employee life cycle, to opening a dialogue, having proactive health promotion. And those are the things that we measure in terms of intention of the organization, the senior leadership team, as well as the HR well-being team. As you can see, it very much takes care of different stages, from the C-suite to the ground level, to practical tools, for people that they can use. And in that framework, we are able to measure. Yesterday, we have heard about the importance of leading indicator, right? In large organization, we know about climate survey, employee survey, and those are lagging indicator. The resignation rates, the people who are absent because of mental ill health, those are lagging indicators. When you know that, the system already sucks, right? And how do you measure the intention? Because without intention, you will not have outcome. And this set of framework actually measures the intention. Okay? And then you can actually tally back into your climate survey, into your exit interview, into your day-to-day check-in or month-on-month check-in with your people and see whether it works. And I'm sure there are the talk and walk gap, right? We talk that we have a beautiful system, but when you walk the ground, nothing happens. And that's where you have the reality check. While we check the intention, the reality check is also check in with your people. Is the culture changing? Right? And when you have your health and safety kind of procedure, you have fire wardens, right? That is walking around, making sure that the safeguards are there. Fire drills, they know what to do. Do you have mental health champions that are walking around, observing people that are behaving out of the norm? A very chatty person suddenly becomes very quiet. A quiet person suddenly starts talking and to people and doing funny things. And these are telltale signs. Okay, while we can't assess the invisible, the mental part, these are actually stress signals that people will show. And if people are trained well enough, you can pick up that sign, you can pick up that conversation, and you can signpost to the relevant help. And that's where it is important. So what are some of the leading indicators that the system, the framework measures? You see that the indicators, things like line managers, training rates, talk about the psychosocial risk assessment data, the policy. Okay, those are the various standards, and it measures the intent about your investment in the capability to support the team, system effectiveness, the quality and consistency of your system embedding a mental health strategy across the life cycle of the people. So things like questions in the assessment will be, does your organization currently conduct psychosocial risk assessment in relation to work design and working environment? So that kind of question. Do you have specific policies in place to address risk of bullying, harassment, aggression with mental well-being focus? And do you track, monitor work hours, overtime utilization of EAP? So those are things that are very practical and measurable. And based on that, we then issue the different maturity in terms of the various standards, and holistically as an organization, we will then issue 4 levels of maturity. One is committed to the plan. Second level is achieving the plan that you have committed. The third level is excelling, and the fourth level is health creating. So those are the 4 levels. So essentially what we are saying is that the framework provides you a holistic solution. For the people that do not have an existing strategy, you can just copy and paste, adopt it wholesale, and it provides an immediate, proven, systematic approach. For those who have a strategy, it helps you to operationalize it further. It helps you to assess it, to ensure that it's holistic. As you can see, the 10 standards It's holistic, it's systematic, and there's no guesswork. And because it's measurable, you can revisit it year on year, and you can actually plan your progress to close the gap. So it's a process, it's a journey. Even when you have reached the highest level, it's still a journey, right? So this is what it shows. The pillars tracks the progress. It's a systematic roadmap. The maturity levels provide you the progression. It's measurable. It's reportable. We talk about C-suite. We talk about leadership involvement at board level. When you have this, and if you want to engage the board level, you can actually report this, right? And it replaces static programs. It's a continuous improvement. So we have run the version 1.0 in Singapore for 3 years. And next year, we are embarking on 2.0 because things have changed and we want to progress. Don't take it from me. The proof is in the people that's using the system. And this is a video from a service. It's a law firm. And it's interesting. Law firm use people to generate revenue. And at the same time, they are very mindful that they don't kill the people when they generate the revenue. And when you take care of the mind, the people's mental health, it would mean that it is a pit stop. It would mean that slower revenue growth. But this is what they believe in. They have achieved health creation. And let's hear from them.
At Linklaters, mental health and well-being is part of our strategic priorities. It's not just words on a piece of paper. It's steps and actions that we all take, hopefully every day, to make our lives better.
Can we
deliver on our client expectations?
Okay, let's rerun that.
Linklaters, mental health and well-being is part of our strategic priorities. It's not just words on a piece of paper. It's steps and actions that we all take, hopefully every day, to make our lives better and to deliver on our client expectations. The Thriving at Work tools really makes a difference in order to enable us to challenge, test, and verify the progress we're making, the initiatives and the steps we still need to make on this journey to actually achieve that sustainable resilience. I'm really grateful for all our peers and networks in the Alliance and for the sharing we make that enables us to improve and make change on this journey. One example I would just like to bring out is working hours. We're not in a 9-to-5 job industry. It doesn't mean that it's a license not to think about how to deliver in a sustainable fashion. So a big thank you for everyone. Please share, please contribute at all levels. And this will continue to make it a place where I am very proud to work at. Thank you.
Participating in the Mind4 Alliance Singapore Thriving at Work assessment enabled us to learn from other member firms by sharing best practices and exchanging ideas. Networking with peers also provided valuable insights and helped us benchmark our initiatives, supporting our commitment to continuous improvement in workplace well-being.
Thanks. That's what I have. Happy to take any questions that you may have. Anyone?
Hi, thank you, Mr. Young, for a good presentation about mental health. I'm from Siemens Healthineers. We just implemented a mental health first aider program globally. Part of it sticks in certain regions of the world, part of it does not, or we have yet to see it bear fruit. So just trying to leverage on what you know about this field since you're a subject matter expert. What is your perspective on the MHFA program and whether this is a good start for a global company to kickstart their mental health program? Or if you have, if it's not, right, what kind of advice would you give for us to enhance our mental health strategy? Thank you.
Thanks for the question, and thanks for sharing about the mental health first aider program that you have rolled out globally. I think that is a very good start. And those who are trained mental health first aider is like your fire warden, right? That's embedded in the system. They are equipped to see the telltale signs and look at stress indicators and be able to point to the right direction for help. But it is not enough, because we talk about first pillar being the culture, right? The body at large, are the rest of the people open to this swing in terms of your investment on mental well-being? The last thing you want is the general narrative is not really permeating into the ground level, and you have mental health first aider running along and say, hey, I think Wing Hong, you are not your usual self, you have been very quiet, why don't you try the EAP? But I'm not convinced. You went for the course, I didn't. And for the last number of years I've been with the company, I have experienced different things, and suddenly you change, right? So what else are you doing in terms of the culture? Are your senior leaders having that vulnerability? Because when I went back to my peers to talk about this mental health program that I'm promoting, they said, Wing Hong, what are you talking about? During our times, we just suck it up. And the older folks came from an era of the Iron Man and the Wonder Woman, right? Because the lack of awareness. And so that's the mentality. So it's a good start to have a mental health first aider. The culture needs to change, and the change has to come from the top. Are your leaders portraying the vulnerability? Are they authentic to say that, hey, it's a rough patch, we are actually facing a lot of headwinds, results are short of expectation, I'm feeling the stress, and let's gather together and weather it. So that is a narrative to say that, hey, I'm not an Iron Man, I'm vulnerable. And it could be even better to say that I'm actually taking time off to make sure that I have my runs, or if they're open enough, I am seeing a coach or psychotherapy to help me go through some of the issue. And that's where I think it will be the start of changing the culture. And when the people see that, and you do it consistently enough, people will say, hey, I think the wind of change is here. Then you fold in your mental health first aider that will really rally the support. You have your talks, the things that we talk about, the spaghetti approach, right? Then it becomes a holistic kind of thing. And the next question is, how are you measuring the impact? That's where I think you also need to have a system to measure the impact. Yeah. I'm out of time, but yeah, yes. If you are willing to stay, I'm here.
Thanks for the presentation. Just a quick one. As we know, you say top management needs to lead by example. Top management usually in this era are from the older era. So they used to cowboy up and let's go on. So what would you say is the best tips or advice to convince leadership to follow mental health initiatives and implement it in the workplace?
Yep. Thanks. Very good, valid question. Very practical. I think at this day and age, with the digital advancement, you need to leverage your workforce, your pulse survey, right? Your engagement score survey. Do you have questions to really hear from the ground? And top management will be silly to just ignore all these telltale signs. And that's where I think you need to really suss out. And earlier on, some of the speakers talk about the younger generation. this is an anonymous, safe way for them to feedback, because the last thing you want is people vote on their feet, right? If I'm a talent, I don't need to work in a toxic environment. I'm a talent, I walk. The last thing you want is you are retaining those people that you want to get rid of. And those good ones are walking, right? So that I think would be the key, and time will tell. So for example, this law firm, they are attracting many talents from local firms. It's high pressured environment. Okay, let's face it, it's not a charity organization. There will be stress. But it is a place that they cater for pit stop. They have an in-house psychotherapist that started 8 years ago, and they have increased it to 2 headcounts. Yes.
Sorry, this is a passion area of mine, so I'm just going to add something, if that's okay.
Yes.
I would suggest to leadership that the way that they've been doing it hasn't been working, so why not try something different? And I think it's not just those periods of stress. I think it's actually just about leading loudly. So I'm going home early because my kids have got to play, or it's parents' evening. Like, parenting loudly gives permission for your people to be able to go and do those things as well. Do you know what? I'm feeling really rough today. I had a really bad night's sleep. Like, I couldn't get to sleep. It gives permission for your people to start having conversations about their sleep, about what's going on in their brains and all of that. And it's really uncomfortable to begin with. And then actually what that does when you're being led really authentically, or where you're leading authentically, people get really comfortable with it and actually recognize that it's a far better way of doing things, because we are all human beings. And every single one of us has a life outside of work that impacts work as well. So, yeah, the way that we've been doing it for however many hundreds of thousands of years just simply isn't working anymore. We know the suicide stats. It's the biggest killer of men under 50, full stop. Like, we need to be doing something different. And if that means that we need to be a bit vulnerable and we need to kind of be a bit more vocal about what's going on for us as individuals, I can't see that that's a bad thing.
Thank you. We can continue the conversation later on, right? Thanks for your attention. Thanks for the time. Yep.